This tutorial will cover two surgical knot tying techniques. The first method is something that I like to call the wings method. So you start by grabbing the threads in your hands like this, and then spread your wings, that's 3 fingers on your dominant hand, and chop the thread. Then bring the other side from behind your hand, and then using the middle finger, you go under and over between the two threads, pinch them between your middle and index finger, and turn your wrist such that you have a knot which lies on top of on the dominant thread, and you place it down. The next part of this technique is called the one finger method, where you have the thread coming from behind your index finger, and then you go using the index finger, you go under the thread from the non-dominant side and turn it over and go in between the two threads. And now you'll notice that the knot is laid on top of the non-dominant sided thread. And this is how you alternate in knot tying, something like what you do in normal suturing as well with the instrument knot. And once you have practiced enough, you'll get the muscle memory for this and be able to do these knots quickly, just like I'm doing here. I'm doing this to show you how the end result would look like. And I'll do a couple more. And you can see here how the knots are stacked on top of each other, and this is something you want to achieve with any way you do the knot tying. As an extension of this method, you could do the wings technique first on your right hand, so spreading your wings out, chopping the thread, bringing it from behind, going under, pinching it, and turning your wrist to get your knot. And now do the same thing on your left hand, and this way also you'll be able to alternate your knots. So chopping, bringing it from behind, going under, pinching it, and then bringing it through the area between the two threads and laying it down. And you could do this also once you gain a little muscle memory in a little faster way. And one thing I would recommend is always using gloves while you're practicing knot tying so that you'll be acclimatized with it when you do it on the OR. So the next way of doing this knot is something called a cowboy technique. So you start with holding your thread such that you have two imaginary guns over your index fingers, like you can see here, right? And then make a C with your index and thumb finger, like this. So the first part is rotating your C away from you, and then hooking the thread behind your thumb, like you can notice here, right? And then bring the other thread over your thumb to make an X with the threads. Yeah. Now pinch your index finger and thumb together and notice that you have a space here in between the two threads. So now you turn your C towards you and pass the free thread from your other hand to the C and pinch it, right? And then bring it back away from you through the space in between the threads, and then you can just make your knot by pulling on the threads. So the first time we went away. Now in order to alternate our knots, we want to start by going towards us. So you start with your guns, but you stay inside. So the thread is hanging over your index finger. And then bring the thread over your index finger, make an X, then pinch your fingers together and turn it away from you through the space and give this free thread to the pinch and then bring it back towards you. Yeah, grab the free thread now and then voila, tie your second knot and you have your two alternate knots. This is the whole concept of the cowboy technique. So as a quick recap, just take a look at how it's done. Yeah, and once you again practice with it, you'll gain muscle memory with it and you'll be able to do it at a good pace. And there you have it. This is the two ways to do knot tying